I was this shy guy that to ask for help was a very, very big deal for me. So I had to like sit tight, do it myself, figure it out myself, you understand? Mentorship basically is try to like provide help for those that are like probably shy to reach out for help. Direction is very, very important in anybody's progress. You need direction. You need
Hi guys, welcome to another episode of Nursing Unscripted, a show that is centered around candid and unrefined conversations in nursing. And remember, this show is proudly sponsored by NCI, Nursing Conception Initiative. And today, I'm more than delighted to introduce to you all our guest for today. He's one of the co-founders of Nurses Connect, and amazingly, is also one of our sponsors here at NCI. And you know, he's one of the people that is trying to make a change, impact in the nursing profession. And I'm so glad that I get to share a couch with him today. So, ladies and gentlemen, with a clapping ovation from wherever you are listening from, can you please join me as I introduce to you our guest for today? Hi.
Hi.
Welcome on board. Thank you so much for honoring our invitation.
Thanks for having me.
Yes, so can you just briefly introduce yourself?
Generally, I'm known as Dagbana Nurse because of my presence online. But my government names are Olatuke Abdulkoyim Timitope.
Okay.
So a co-founder of Nurses Connect, an initiative that is looking to create impact in the nursing field, majorly to educate, orientate nurses, and enlighten them on different career paths that are present in nursing, majorly to impact and educate. That's what Nurses Connect is all about.
Oh, that's impressive. Thank you so much for that response. When you said Dagbana Nurse, so it's giving this vibe of I'm not the type of person you want to mess with. So can you just briefly tell us the story behind the name?
Okay. I don't know. The name is actually like not a serious one. A lot of people, when I tell them I'm Dagbana Nurse, they expect
Like you should joke with.
No, I'm very, very friendly actually. Very, very friendly. But then the name actually has like a history. It has where it comes from. It's all dates back to like 2021. I think, let me say that I was in 300 level. I was just figuring out my ways in nursing. You know, 300 level, you get to like introduced to different nursing methods, MSH and all. So then I was trying to like figure out what am I going to do with nursing? What am I going to do with nursing? So it was also this time that I don't know, say this often though. It was this time that this Nigerian artist, they call him Dagbana Republic because he's unruly, like he has a lot of behaviors, and then I'm basically like focused on mental health. So I have like my focus is basically on mental health. My content creation is basically on drug abuse, mental health. So and there's this name that's attached to like all people that are not doing well mentally. They call them Dagbana Nurse. You understand that kind of thing. So I just like okay,
it's just like
taking a like a nurse that is meant for people that are not like
that's so creative, like very creative. Oh, that's so creative. Thank you so much for that. So, you know, patients often refers to male nurses as doctors. I think you must have had that experience before. So, you know that when they see nurses that are male, they feel like, oh, this one is a doctor. So tell me, how did you find yourself in this female-dominated profession?
Well, for me personally, it has always been it or nothing else because I have one of my parents who works in the health line.
Oh, so it was inborn.
I don't have any choice than to do anything health related. So then I mean there's a little bit of history again too because I tried to like study a different health course than nursing actually. I applied to University of Ibadan for physiotherapy after finishing my secondary school for physiotherapy, and then I didn't get it. I missed it by 0.5. I missed it twice actually. So then I then applied to LAUTECH because LAUTECH doesn't have physiotherapy, and they don't have pharmacy. I was like inclined to those two courses. So then they had medicine. I never thought of nursing actually. So they had medicine. I was just like, okay, let's go for medicine. Then again, they didn't choose me.
I think that's God ringing a bell that nursing is your way.
They didn't choose me for medicine. And then I was like, okay, I'll fight my way up, get a good GP, try to pursue medicine the second year. Like, so I did well, I had a very, very good GP. And then when it was time for me to like course, then medicine was not, they were not taking any coursing.
Nothing or anything.
So then the only option I was left was just nursing. I was like, yeah, let's do nursing. Wow. And that's how
so in one word, how has it been so far?
Breathtaking.
But at least you're enjoying the profession.
Definitely, yes.
So that's impressive. Thank you so much. So still on gender, there is a lot of stereotype attached to male nurses being in the profession. So being a male, how did it help you in this your nursing journey?
Like you mentioned when you were asking the question, you said stereotypes. I mean, there has been like a lot of discussions around nursing, like because how do you? I mean, when I coursed into nursing, I coursed in all the boys in my class we are, I think, 25 out of 189 students.
That's
so fair. Then because I'm like apologies to all the ladies because the profession is majorly dominated by females. There is a way they look at the profession, like I don't know why they don't give us the respect that we deserve.
I think that's basically the media also contributes to that.
Exactly. Yeah. So there's a lot of contributing factors. Yes. So then like being a male in the nursing profession actually like brings like the presence and the respect that the profession actually needs, like the presence basically, like that voice that we need, the voice that we needed for a very long time, because male depends on male in that profession actually like give that voice that we've been looking for. So basically that's what I say.
That's a good one. Thanks so much for that response. So moving on to the next question. So here you are, you're a nurse. So what has been your motivation so far? Like based on all this stereotype and everything, you didn't back out. You didn't say that, okay, I want to try jump again and go and do medicine. So what has been your driving force?
Can I say money?
Okay.
Because yes, I love money actually.
Everybody loves money, exactly.
But then basically, like I said earlier, if I don't do any earth course, I don't know what else I'll be doing actually. So my motivation basically is just like I see the earth sector as a sector, like as an avenue to make impact. I mean, as a nurse or a medical doctor or a physiotherapist, you are impacting people's life. They're coming to you for a solution where they're seeking, like when they come to your facility, they meet you as a nurse or any other person, they want solutions to their problems. And the fact that you can attend to them and provide solutions to those problems that they bring to you is one impact that I actually look forward to every day. I mean, some people online, I am big on, okay, let's just make money out of any profession. If they are seeing this, they might be looking at, okay, this guy, you have passion for nursing. But then it's not just about the passion, it's the impact that I feel like we have the ability to make.
Impact, like
the level that we are. So basically, that's the motivation.
Wow, Thank you for that. That's very impressive. So let's move on to the mentorship, to the role of mentorship in nursing. So what do you think is the role of mentorship in the nursing profession?
The main reason why Nurses Connect and NCI are actually like organizing this mentorship program is because actually for my own story, because when I wanted to I have a founder, I told you I'm a co-founder.
Yes.
I have a founder. So while I am a founder, we're discussing, I told him my story. I told the founder of NCI to not study only my story. Also, when I was sharing my story with him, that when I was in school, I was this. If you see me now, I'm not shy anymore, though.
You don't look like it.
Then I was this shy guy that to ask for help was a very, very big deal for me. I mean, even to walk up to my friends sometimes to like seek help is
a big thing.
It's a very, very big deal. So then if I want to do anything, as small as like just not getting something in our class or in our courses, I have to like do an extra work, focus, like because I cannot reach out here. So I have to like sit tight, do it myself, figure it out myself. You understand? I mean, it worked for me.
Yeah.
But then it might not work for like a lot
of
people. So especially like students that are in my cases. So we're trying to like mentorship basically is try to like provide help for those that are not like probably shy to reach out for help, don't have the help available at the moment, or they just need help at any point in their career. I mean, direction is very, very important in anybody's progress. You need the direction. You need those people that have they've checked the paths that you want to take before. You need them to like just tell you just take the steps. Once you take the steps, you figure it out. So basically that's why the whole mentorship thing is all about. So just like create help, make it easy.
Yeah, I think it's just like a way of bringing people closer together.
And basically that's
I think I was able to, yes, personally I got something from that, because when you have access to mentors, like it becomes easy for you. What you're trying to do, someone has done it before, so why not tread that path? And
it's just connecting people that need help to do
that can actually help them. Yes. So in nursing profession, do you think we have enough mentors?
I will not say that there are a lot of people that could be mentors. Let me put it that way. A lot of nurses that could be mentors. But in nursing there is this saying that we say there is hierarchy in nursing. So up on the ladder.
So you look at them up there,
that could just like guide you. That could guide we young nurses to whatever we want to do. But because of that, that ladder,
the gap in
then,
between,
so we're trying to like we need a way to like bridge that gap, bring those people closer to the mentors up there. So there are a lot of mentors, people that could be mentors and also not say that could be like that could provide guidance. I mean, there are a lot of them. We have them in abundance. You just need to like take up the roles of mentors to take up a few mentees and guide them basically.
Yeah, you're very correct about that. So what steps do you think should be taken by nurses, especially nursing students? Like you said, we need to we need people that have done that thing that we are trying to do. So what steps do you think can be taken by nursing students to position ourselves in like mentorship position?
For me, I will make it simple. I mean, one is be teachable. You're a nursing student. You're a student. Either you're a student or you're a young nurse. You're a nurse or whatever level that you are. There is someone there that is above you. Like everybody get guy. We used to see that on the street. So there is someone there that could still like teach you one or two things. So as a student, basically, you need to like be teachable. And also there is another thing that you need to learn is the ability to like to seek help, to reach out. Like you should never underestimate the power of asking. Like just ask. Even the Bible said ask and it shall be given unto you. So so just like you need to like be able to like reach out, learn to reach out. You cannot, there are some things that you cannot figure out yourself.
Definitely.
You just need to like walk up to people
and ask them for
and while you walk up, you need to be respectful and you need to like be ready to learn. And another thing is that have something that you want to offer. Mentorship nowadays, we've like seen mentorship as just a means to get access.
So
people just like, okay,
I know this person now. I know this person.
So that's not what mentorship is all about. Mentorship is all about is like a symbiosis relationship.
So you have something
to me, no matter how small. Forget the fact that you're a student or you're just coming up. There's always something you can offer. It could just be your time. It could just be your voice. It could be your presence. There's something you'll be able to offer. So be ready to like offer something. Because these people too, they're offering you something. So be ready to like offer something. Like that's to be a symbiosis.
So that means personally you should add value to yourself, basically. Okay. So talking still on mentorship. So who are your mentors? How did you meet them and why are they your mentors?
It's funny that the truth is, sorry, the truth is, as someone that is working on providing mentorship for a lot of nurses, I personally don't have an attached mentor like this. I don't have someone that can say, okay,
this is a
personal mentor that I'm doing with me for me. But then I have people that I look up to. I mean, they inspire me. I admire their work. You understand? I admire what they've achieved. I admire how they achieved it. I admire what they're doing. I want to do something like that. I want to do better. You understand? So I have a lot of them. I have a few that like I hold tight, like I'm emulating their stuff. So if I can mention, there's one person. A lot of them though I met them online. There's and I mean I don't really have much nurses because majorly what I do is basically like my content creation is online. I work online a lot, like so most of the mentors that those people that I said I had now I met them online. We've met physically, we've met online, we've discussed online, we've had calls, and yes, I admire them.
Can you mention a few?
Okay, there is one person, like there's a lot of them. I mean a lot of them. I tell them every time online that you inspire me. But then there is let me mention three. The very first person on the list is I don't know if you guys know him. It's Dr. August Bones.
Tell us about him.
Okay, Dr. August Bones is actually like what I admire most about him is the caliber of the certificates that he have, what he has learned so far, his experience. He's a master. He has masters. He has like 2 masters, 2 PhD.
Impressive.
And then after the 2 PhD, now went back to do nursing. Went back to do BNSC nursing. Yeah.
Oh, what kind of fashion is that?
So, one day I will walk up to him and ask him why do you do that?
Yeah, exactly. I think
before doing nursing, I mean while he was even doing nursing, he's a lecturer. Like he lectures in university in Nigeria. So I don't know, I think it's Okada campus, what they call that in university. So like he lectures and then he was doing BNSC. I think in the same school. In the same school that he lectures.
That's mind blowing.
So like, I mean
that kind of person is not looking for money. Like
exactly, it's not no money is not his motivation. It was never his motivation. He was okay. He's a lecturer. He has a family. I mean, he's doing fine. Then why BNSC nothing? Yes, and even had all the RN outpatient that we all had.
That's so impressive.
And so when I met him, I met him as a nursing student, but then I've seen like his certificates online, and I think what his major is in immunology. So immunology basically. So, and I think now our last conversation, he mentioned that he's on his way to being an associate professor in that same university. So that kind of person like actually like inspire me. I want to do something like that.
His level of passion.
He's someone that I walk into his DM every time. Sir, what do you think about this, sir? And you upon this, no?
I think that's actually the role of mentorship. Exactly, you have people, you have easy access to them.
Exactly, like I could just ask questions. I can just look into his DM, ask questions, ask for clarity. Another person that a lot of nursing students should know this man is called the Cold Nurse on his social media platform. His name is he's not a nursing consultant. He's also a PhD that is a doctor too. His name is Akingbade.
Dr. Akingbade, yes.
He's a nurse researcher. Yeah. So into like his thank you so much. So into like his achievements, his another thing that motivates me, like exactly, his rise up to the ladder to scholarship and everything. I mean, I tell him a lot that it inspires me. Those are the kind of people that like I take as
look up to. Yes.
Then there is another person, another woman. She's a I cannot mention mentors in the female dominated profession. I know I'm a woman.
Exactly.
So
give us our flowers.
I met her online rather. I met her online too. And she's come with Lawal Aridun, and she's like living the life I want to live with. I'm thinking of living with nothing, attending conferences outside the country. Like I see her status, Rwanda today, another country tomorrow.
So it's like type of people you see and you feel like, God, I need to do more.
Exactly, like that kind of accessibility to the world is one thing I want to achieve with nothing at all. Even though I want to achieve that with nothing. And she's already attending conference with ICN president. You know, it was true that I even know the name of ICN president. When I see her post, I'm like, okay. So this is what this person is. She's another person that actually like inspired me a lot, and I take her as a mentor. You know, so.
And that's a very good one. Like me myself, I think I need to go and check those people on Instagram, and
you can most of them I met them on Twitter. So
okay. Yeah. So talking about social media now, what is your favorite social media platform and why?
I just mentioned it, Twitter. I mean, I love Twitter a lot because there is a lot of resources on Twitter. Twitter has like, forget about the drama that happens every day. A lot of drama. Yeah, sometimes the drama like overshadows the other things that is present there. So Twitter is a very, very good place to connect, to learn, to meet people, to learn. I mean, you learn every day on Twitter. Whether useful for you or not useful, you shall learn something. So
I think Twitter is majorly known for the banter stuff.
Exactly. I mean that banter is what people think is just about. But then if you go on there, like you see resources. I mean resources. Even before I started creating content on Twitter, I've had resources that I've already bookmarked for like they are there. You know, I was at a point, and just at a point I was learning UI UX, and the old resources that I was using to learn UI UX, I got it free on Twitter. Yeah. Just free resources. I was just using it to learn. So, you understand? So
that makes it very like a very good app. So who are your favorite nurse content creators and your favorite nurses?
Favorite nurse content creator. I will choose myself.
You are one.
Then okay. I like what Cloud Nurse MJ does.
Okay.
I don't know if you are familiar with
yes, yes,
Cloud Nurse MJ. Like she creates content on Twitter and Instagram. Yes. I like what she does. There's another woman that I like her content. Sugar Nurse.
Yeah.
I like her content too. I like her content also. And then who else? I like my content also.
So moving on to the last question. This has actually been like a mind-blowing session. Me myself, I've been able to learn one or more things from everything that you've said. Like, thank you so much for sharing your experience, your own knowledge about mentorship. So moving on to the last question that we have here. So what advice would you give to that young nurse that is coming or already in the profession?
Coming or already in the profession? Can I say make money?
I am big on this money thing.
You need to make money, please, as a nurse, because
yes, I think money.
But then be open to learning. I'm big on learning. Like learn as much as then connect with people in your level, people above your level, people below your level. Yeah. Connect with people because the gift of people is a very, very big one. And then what else? Explore social media, please. Yeah. There's a lot.
Yes.
Benefit that comes to social media. Me myself, like I will not be here today even for social media.
Yes, I think social media gives you that presence.
Exactly. So I will not even make it to this studio without social media. Explore social media, the good aspects. Explore it. You can do anything with social media content. You cannot say you cannot underemphasize how much content can fly. Yeah.
So just put yourself out there. Physically, you just have to be out there to be the presence that you need. That's a very good one. Thank you so much.
Thank you.
So we are not done yet. I hope because this session, I'm actually sat for this session, and I hope you are ready for this session that we are about. The fun part of it all, which is the game session.
Okay.
I expected to see you smile now.
Okay.
So we are moving on to the game part. So I'll be showing you some images, So I just want you to, I'll be asking you a few questions as well. I'll show you some images. So I want you to identify those images. And do you want to listen to this part? The most amazing part of it is that you stand a chance to win 50,000 naira.
Hey.
But there's a but. But for every question that you miss, you lose 10,000 naira.
That is more. 2,000 is too much now.
That's like you need to work for it. You know, you like money. Now I want you to put your skill into use. I know you will want to win.
Bring it to 5K.
No, 10,000 naira or nothing.
Okay.
So let's get started.
I hope you know.
I hope you're ready.
I'm not
So
ready.
to the first image, can you kindly identify this image? What does it look like?
It looks like.
The time is ticking you.
How many seconds do I have? This looks like an instrument used by the orthopedic in surgery. Looks like.
One.
I don't want to call it Jizu, but
Two.
what's the name? God, how do you guys keep my mind?
4.
Oh.
5. Okay. I'm so sorry to inform you. You actually tried, but then you didn't get it. This is an osteotome. You actually you were on the part. Yes.
Like I don't.
You actually tried. So 10K is gone.
You mean 40K?
Yes. Yes. No, you see, I have a whole of 40K. Calm down. So the next instrument that we have here. I hope you get this one. No.
God, how did I forget that one? God.
Nah, don't worry. It happens. So this one, what do you think this is?
Oh, this is a part of endoscopy machine.
Okay.
What is this? God, what is this name again?
Should I give you a expo? You just mentioned endoscopy machine. So what do you think this will be? It's something that ends with E.
Look like the scope.
Exactly, but I think I will be the one to get that 10K because I was I gave you a expo. I gave you a expo for that one. Yes, yeah. Thank you for sharing. You're actually correct. So this is a scope. Okay, so to the next question that we have on the list. So in 5 seconds, just have 5 seconds to mention the principles of bed making.
The principles of bed making.
1.
Principles of bed making.
2.
What? You guys are taking me back to 12.
That's the aim. 4.
Relax now. 5 seconds is so small.
Okay, 4.5. 5.
I cannot say this in 5 seconds.
Oh no, do you want me to spill the tea? Actually, I learned it with one acronym. I used I want shawarma plus barbecue in class today.
How will I mention that in 5 seconds?
Okay, should I try it for you?
5 seconds?
Yes.
I will count 5 seconds.
Oh yeah, count 5 seconds.
5.
Infection control.
3.
Okay, calm down. Yeah, wait, let's start over again. I want to control my laptop, please. Infection
5,
control.
4,
Privacy,
3,
body mechanism.
2, that's it. You see, 5 seconds is not enough. See?
5 seconds will be enough.
Okay.
Okay. So now you have how much left? You have 30K left.
Is it 30K?
Yes. You only want one question,
Okay,
so you still have 30K left.
I'm still a rich man.
Yes, you are still rich, so you still stand the chance of winning 30K. So
But I hope 10K already.
Yes, you have 10K already.
At least I'll go with 10K.
So okay, what? Who tells you that you're going on with that? What about if you miss another question? So to this one,
how many questions, Papa?
Why are you in a hurry?
I'm about money in my place.
Calm down,
Okay.
don't worry. If you get it, you go with your money. So this one, can you identify what the nurse is doing in this image?
Have a closer look. What the nurse is doing in this image?
Yeah. 1, 2, 3, 4, 5.
Checking the temperature.
It's not checking the temperature.
I can't
Okay. Okay. You didn't recognize what the nurse is doing.
What are you doing?
I think your time is up. Don't worry.
I know my
You
time
didn't
is up.
even win the money, so don't worry. So I'll just tell you the answer. So this is a quantitative fit test. So that's what the procedure the nurse is performing in this image.
God.
Of the quiz session, you are going in with just 10,000 naira. At least, and give yourself a clap of renown. You tried. So yes, it is just something I know, right? So thank you so much for participating in the quiz session, and I hope you've been able to learn too. At least you've been able to juggle your memory a bit.
You guys thinking back to 2011?
Yes, that's okay. So thank you so much for participating in this session. And finally, we've come to the end of the show. Thank you so much for honoring us. Thank you so much for coming on board. So our viewers at home, thank you so much for staying with us to the end. This remains Nursing Unscripted. If you are new here, click the subscribe button and be part of the family. And don't forget to like, comment, and share with your friends and family member. So we mentioned earlier that is a co-founder of Nurse Connect. So you can do well to check it out on Instagram. Their social media handle is currently being displayed on the screen, so you can check them out. Also, do well to follow Nursing Unscripted on Instagram. Thank you so much for joining us today. See you next time. We love you. And then let's wave a goodbye to the viewers. Bye.